Thank you, Mr. President. I also rise in strong support of SB 101, and I want to speak on the issue of Proposition 36 funding and implementation as the chair of the Senate Committee on Public Safety, and want to just acknowledge the work of my colleague, Senator Richardson, chair of Budget Sub 5, on this important issue. We are honoring the will of the voters. $110 million is earmarked in this budget, $50 million for behavioral health services, $30 million for court costs and implementation, and $15 million for pretrial services and to fund public defenders who are going to be providing legal representation for individuals that are charged under Prop 36. And let me put this in context. The governor's budget didn't have anything around Prop 36. And to my Republican colleagues who supported Prop 36, the proposition had no money included in that proposition. It was an unfunded mandate. So that puts the responsibility on us, the legislature, to have to fund the implementation of this important measure. And we are committed to honoring the will of the voters and making sure that this is implemented the right way, which is why over the past several months, we've had several conversations, joint conversations with Budget Sub 5 and the Public Safety Committee about how is this being implemented on the ground at the county level, at the state level, at the local level, and what are the needs? And I'll have to say that we don't yet know what the true costs are for implementation of this measure because we're in month 6 or 7 since this law took effect. And so it's gonna take time for us to understand what the needs are and to budget appropriately to help support those needs at the state and local level as well. I also wanna just address one issue and discount one issue that was also addressed. You can't use cap and trade, the GGRF, the Greenhouse Gas Reduction Fund, to fund Prop 36. So I hear all this conversation about high-speed rail. Oh, we're spending billions on high-speed rail. You can't use that fund, which is funding high-speed rail, to fund Prop 36 implementation. That needs to come from the general fund, and we are doing that as part of this budget proposal that we are considering today. So once again, it's gonna take years to implement this measure. This is year 1 of a multi-year implementation plan. And it's gonna require cost sharing and partnership between the counties and also the state as well. Keep in mind the counties control behavioral health services, the court legal process. The cost can't be borne just completely on the states. It also has to be borne by the local and county levels as well. And I just want to acknowledge there are ways that we could also fund this as well through Prop 47 savings. And we'll lift up the work of my seatmate, the senator from Santa Ana, who has a bill to use some of the Prop 47 savings to help implement Prop 36. There's no doubt that funding for treatment is woefully inadequate in the state. This is the beginning of an investment that will make over several years to help ramp up the amount of treatment beds and treatment services in California so that people aren't sitting in jails, which is what's happening now, to be quite honest with you. You know, the number of people that have been charged under treatment mandated felony far outweighs the people that are being charged under retail theft provisions of Prop 36. And they're just sitting there in a jail, costing the counties and the state a lot more money to incarcerate them than to get them the treatment that they need. And so I know we're all committed across the aisle to help fund and expand treatment in California. This is the beginning. Let's work next year and the year after that to make sure that we continue to ramp up the implementation of this measure. This is a start and we'll continue to prioritize it. I also just want to address briefly a few other issues. Respectfully to my friend, the colleague from Huntington Beach, talked about this budget creating a massive deficit. And I would posit that the massive deficit that's being created that we will deal with now, we'll deal with in the next year, is because of this administration's disastrous trade and economic policies that are damaging the state's economy. In addition to the looming significant cuts that will be implemented by the House Republicans' spending bill, which will decimate Medicaid and require us to have to go back to the drawing board to make even further cuts to make sure we can fund healthcare, universal healthcare in California. So let's just put this in context and really talk about what's really going on here. It's because of the larger economic climate that we're facing in the state that is hurting California's budget and hurting Californians, including increasing the cost of living for people in the state as well. On a different matter, frankly, we were faced with an impossible task. And given all those factors, how do we create a balanced budget? How do we prioritize the many needs that we have in the state? And I would say that this budget balances many of our state's critical priorities. And specifically on housing, it reverses cuts that are critical to helping build low-income homes in California, such as the low-income housing tax credit program and the multifamily housing program. Yes, we're not providing enough money for the HAP or flexible homeless funding program. Keep in mind the governor's budget zeroed out that program, but this is the beginning. And I would also encourage, maybe we should move up round 7 so we can get those existing dollars out the door now while working to identify the funding for future years to make sure we can increase our investment in addressing homelessness in California. Lastly, on Medi-Cal, I just want to lift up the really difficult work of the Budget Sub-Chair, Senator Weber Pearson, and Budget Chair Wiener on addressing what I frankly say was a really bad proposal that would have not only increased healthcare costs and make it unaffordable for so many Californians to access Medi-Cal, but would have further reduced the number of undocumented Californians that can access healthcare. And so I think we have done the best we can to reverse some of the most problematic parts of the governor's proposal while making sure we have a balanced budget. So tough times are ahead. There's no doubt about that. But this budget is balanced, addresses many of our state's needs, and I respectfully ask for an aye vote.
Thank you, Senator. Senator Richardson, you are recognized.